Today we will be discussing Case Study B. It is a scenario we focus on Belle, an experienced and senior nurse on the post-CVA unit who is known to be overconfident at times. She's also unwilling to follow directives and policies. Belle's know-it-all attitude resulted in hospital-acquired pneumonia for a patient who was aphasic. Belle's mistake was reported to the manager by Michelle, another RN, who also mentioned it was not the first time Belle has made a mistake like this. However, when the manager was looking into Belle's profile, there was no point of concern. So today we will be stating and analyzing the issues in order to identify recommendations regarding how to manage this case supported by rationales. So the key concepts that we will be covering are the CRNBC nursing standards of taking action to promote the provision of safe, appropriate, and ethical care to clients. We want to make sure that the client is the primary concern in providing nursing care. Second is accountability and responsibility for our own nursing actions and professional conduct. Thirdly, we want to report incompetent or impaired practice or unethical conduct to appropriate persons or body. And lastly, communicates appropriately in interactions with clients, colleagues, students, and others, thus demonstrating honesty and integrity.
The outline for our case study is as follows. We will provide an overview of the case scenario with role-playing and narrating. Then we will review some main course concepts that is relevant to our case study. We will identify 4 main issues, followed by an analysis of the main issues and recommendations for improvement. We will provide references for our work at the end of the video. We will now present our case study. Here are our roles. Sarah as the manager, Emily as Belle, the RN, Min as Michelle, another RN, Annie as the family member, and Aaron as the patient.
Sarah is the manager responsible for a medical unit in an urban hospital in BC. Many patients admitted to the unit are post-CVA and often have difficulty swallowing. Belle has been an RN on the unit for 5 years, and prior to that worked for 3 years in a long-term care facility in another province. She is generally well liked by all the employees and well respected for her experience with the elderly population. She is always punctual and rarely misses work. Belle, like the other RNs on the unit, is a member of the BCNU. Belle has a reputation for being overconfident at times and does not always follow directives or look up and follow policies, indicating she just often knows because of experience and years of practice. The manager receives a complaint from Michelle, another RN on the unit. She indicates that Belle has fed a patient a regular diet, which included thin fluids. This patient was aphasic, had difficulty swallowing, and was noted to be at risk for choking. She was on a puree diet with thickened fluids only. Unfortunately, she now has hospital-acquired aspiration pneumonia. And her family is asking the staff why this happened. Michelle noted that this is not the first time Belle has not followed policies and protocols. She wants something done about her unethical standard practice before a patient dies. Upon reviewing Belle's file, the manager does not see any points of concern. In fact, her performance appraisals are positive.
Nursing management considers ethical situations surrounding the client, staffing, and unit and professional culture. In CNA Nursing Code of Ethics, there are 7 types of ethical situations: everyday ethics, ethical violations, ethical dilemmas, ethical distress, moral residue, ethical uncertainty, and ethical engagement. In this case study, we observed ethical violations, referring to the action or failure to act, thus breaching fundamental duties to the person receiving care or to colleagues or other healthcare providers. Ethical violations were identified through this case's 4 main issues.
The first issue that we've identified in this incident is that standards of nursing care were not met and a patient's health was compromised, as evidenced by the patient's current health status of hospital-acquired pneumonia. This was due to the RN's mistake of allowing the patient, who was aphasic, to consume a regular diet with thin fluid instead of a pureed diet with thickened fluids only. Bell did not make the client her primary concern in providing nursing care by not following directives or looking up or following policies.
There was a failure to report multiple previous incidents leading up to the current situation from the staff members. Lack of reporting incompetent or impaired practice or unethical conduct to appropriate persons or body. Due to the lack of reporting, no improvements were made to solve these issues.
There was a loss of trust in hospital staff and healthcare professionals from patient and her family after the incidents, as patient's health was compromised. Patient's family want an explanation as to why and how this incident happened.
The last issue is lack of effective communication between staff members. This may impact the continuity of care for patients and quality of care.
We use the ethical decision-making model in order to analyze and create recommendations for this case study. The steps to the ethical decision-making model are: number 1, gather background information. 2, identify whether the problem is an ethical issue. 3, identify key stakeholders. 4, identify possible courses of action. 5, reconcile the facts of the case with relevant principles. And 6, resolution.
Within our nursing standards, one of our main objectives is to take action to promote the provision of safe, appropriate, and ethical care to clients. This nursing standard was not upheld by Bell due to her mistake of giving an aphasic patient a regular diet with thin fluids, resulting in hospital-acquired pneumonia. Bell has been an RN on the unit for 5 years with previous experience in long-term care as well. As a senior RN on the unit, she should already be aware that the unit often admits patients with post-CVA, most of whom have difficulty swallowing, as mentioned within the case study. This mistake also does not reflect the standard of functioning with level of competence. Part of our nursing duty to provide the safest and most ethical care to clients. To do so, it is important to refer to directives and policies. In Bell's case, she should have referred to directives and policies related to providing care to aphasic patients, assessments, priorities, plans of care, etc. The recommendation for this issue is, it is important to ensure that Bell takes responsibility and accountability for her own nursing actions and professional conduct.
Bell and the manager met and analyzed the situation. They first discussed the root cause of the issue, which is what led to the client having hospital-acquired pneumonia. They also discussed concerns that other staff had regarding previous incidents. The one-on-one conversation is direct and honest, with the intention for both sides to voice their thoughts and opinions and find out background information. Bell and the manager also discuss what could have been done differently to prevent the same incident from occurring, and what critical thinking skills would be necessary. as well as what policies and protocols were relevant to the situation and how they can have been used. After thorough discussion with the manager, Bell would be able to make improvements to prevent future occurrences of the same issue by following the manager's recommendations.
Michelle should write up an incident report and put it in Bell's file. The purpose of the incident report is to document the exact details of the occurrence while they are fresh in the minds of those who witnessed the event. The information may be useful in the future when dealing with liability issues stemming from the incident. Incident reports are for quality improvement purposes. Unreported impaired or incompetent practices may pose a significant risk to the public. It has been noted by Michelle that this is not the first time Bell has not followed policies, protocols, etc. However, when evaluating Bell's file, there are no points of concern. This may indicate a lack of reporting incompetent or impaired practice or unethical conduct to appropriate persons or bodies. The recommendation for this issue is to take action in guiding and teaching the healthcare team about the importance of reporting incompetent or impaired practice or unethical conduct, and validate with the staff about the significance of reporting. Also, ensure that Michelle has filed the incident report appropriately and within a timely manner.
To improve practice and the provision of care on the unit, the manager held a debrief session with the staff regarding the incident. This gave all the staff the opportunity to voice their thoughts and opinions on the issue and other existing concerns. This session should also include teaching and reinforcement of practice standards, policies, and protocols. The importance of these should be highlighted and reinforced so that similar future incidents are prevented. The debrief and teaching session should be held in a private room to ensure confidentiality, and attendance from all staff members are encouraged. The discussion is open, respectful, and confidential to the staff of the unit and the clients and families involved. The manager also met with both Bell and Michelle to discuss the incident. She encouraged discussion between the both of them and other staff on the unit. This encouraged honest, open, and thoughtful communication within the staff members and facilitates effective working relationships and a positive working environment. Also, she ensured that Michelle file an incident report for the current issue and for future rising issues, and that these issues are discussed among the staff members.
It is also important for the manager or coordinator to disclose this incident to the family of the client. According to CRNBC, the nurse has to demonstrate honesty and integrity. Under CRNBC duty to report, nurses have legal and ethical duties to report incompetent or impaired practice or unethical conduct of regulated health professionals. After Bell and the manager reflect on the situation, they should talk to the client's family members and disclose the full incident. The family has the right to receive full disclosure and know the truth behind the situation. It is important for the manager to report to the regulatory body. Before submitting a formal report to them, we have to contact the person at the regulatory body who is responsible for dealing with complaints to discuss our next steps. If we are required to file a formal report, we'll have to submit the report in writing to the Register of Regulatory Body in which the health professional is a registrant. The report should be as complete as possible without unnecessarily invading the privacy of anyone else who may be involved, for example, another healthcare professional or a client. It is the regulatory body's job to investigate our concern, which is about Bell's inability to provide competent care due to not following hospital policies and directives.
is influenced by situations. The goal are to share or acquire information with the intent of developing a shared understanding, to negotiate roles and responsibility, to advocate for a client, to complete administrative functions, and to provide feedback on clinical performance.
Communication is a key component in providing client-centered care. The standard of client-focused provision of service states that the nurse provides nursing services and works with others to provide healthcare services in the best interest of clients. Nurses communicate in many forms, including verbal, written, and electronically. Nurses also communicate with many people, including clients, families, other nurses, and a healthcare team. Other times it occurs within a small group of interdisciplinary team or with a client and family. The recommendations for the previous 3 issues all involved a form of communication. First, communication occurred between the manager, Belle, and Michelle. Then the manager communicated with the healthcare team and other nurses. And lastly, the regulatory body, client, and family were involved in the communication process.
Alright, so in summary, we want to be able to take action to promote the provision of safe, appropriate, and ethical care. And to do this, we must maintain our fitness to practice and abide by the facility's directives and policies to ensure that the safest and most appropriate and ethical care is provided. We also would be able to take accountability and responsibility for our own nursing actions by owning up to our mistakes, as evidenced by how Belle did it. Thirdly, we want to report incompetent or impaired practice or unethical conduct to appropriate persons or body, and this can be done by understanding the significance of incident reporting and how it supports safe and ethical client care. And lastly, to support communication appropriately through our interactions with clients, colleagues, and others, we have to demonstrate honesty and integrity among our colleagues and with the family members if any issues or concerns arise. Overall, thanks for watching, and I hope to see your D2L comments shortly.